Everybody, this is Dr. Schroeder with this week's video introduction to week number 2 of our course in nursing theory. And we're off to a really good start. Had a really good, robust week of discussion the first week. The first week was primarily focused around a question that always seems like it's daring to tangle with angels almost when it's brought up, is this concept of nursing. And is nursing a quote-unquote true profession, or are we something less than a new profession? Are we just an occupation? And this discussion that frankly has been around in nursing for a long time about, does nursing really truly as a discipline raise to that level of a professional discipline that should participate in the direction of healthcare equal to medicine and social work and physical therapy and occupational therapy and psychiatry and psychology and all of these other different ologies. Are we really truly a science where we can say that we are different and distinct enough and unique and independent enough where we can operate on that level? And this is something that has been an evolving question. And of course, the first thing that comes to mind, and the first thing that many of you jumped on, is as soon as that question is asked, well, of course we're a profession. I mean, we've been to school, we've been through all of us as RNs, regardless of the educational level that you have, been through an arduous process. And an argument can be made that whether you're a master's degree in nursing, a bachelor's degree, or an associate degree, everybody has the same licensure, everybody has the same scope of practice, and there's really no fundamental difference. So therefore, if you have all of these people as registered nurses operating the same way, shouldn't they all be considered as professional? And the other side of that is like, well, if the entry level to nursing is something less than a professional degree, and an associate degree is not a professional degree, an associate degree is a vocational degree. That was originally how it was conceptualized. Then the question is, are then all RNs, can they be considered professional or not? And it's not so much to try to get into a discussion as to, do we act professionally or are we real true professionals? That's not really the idea here, or why it's important. The reason why it's important is that as a discipline, we have to define ourselves as different from and something distinct from the medical model, and something distinct from what happens in medicine and what happens in all these other disciplines. And if it becomes too watered down, or if we're really truly what we do is simply aid physicians in their work, then we're truly not really professional. I mean, from a professional standpoint. And so that's why we have to really examine and look at and be able to defend and really talk about those things that make us a true profession. And that's going to take us into our discussion in week 2, because that's really what this week is all about. In week 2, we're going to start getting into the core meat of the class, which is talking about nursing theory. And nursing theory is one of those topics that as soon as it's brought up, a lot of people like to roll their eyes and think, oh my goodness, nursing theory. It just sounds so dry, and it just sounds so, I mean, I'm a nurse. Why do I have to have a theory to be a nurse? I know what nursing is, so why do I have to have a theory? And the answer is because a theory really is the framework for what our profession is all about. If we don't have a theory, then we really truly do not have our own discipline. Other disciplines are able to explain what they do and explain their theoretical concepts from a theoretical framework. Physicians and doctors, the medical profession, they follow the medical model, which is disease focus. They are the ones that treat disease and focus on disease. Pharmacists, they focus on the pharmacology and the chemical adjuncts that you can use to affect disease. We in nursing are much more holistically focused. We really treat the entire person separate from the disease. In nursing, we don't really concern ourselves so much with what is the diagnosis a patient has. We're more concerned with what are the person's what are their strengths? What are their weaknesses? How are they able to care for themselves? All going back to Nightingale's framework, which is the original framework, which essentially defines how nurses are the ones that are the true carer of individuals in a hospital, in a healthcare setting. And it is true that we do aid the physician, we do help, and we're adjuncts to medicine, but we're a separate discipline. We have our own body of research and our own body of empirical data that proves what we do and shows what we do. And so that's why theory is important. There's different theories that have been used to define nursing practice. One thing I'll say at the outset is that no one theory is right and no one theory is better than another's. There are just different theories that fit different situations. And that's where we're going to start our discussion this week. Your primary discussion question is going to be on identifying some of the evaluation points of theory using your textbook, and talk a little bit then about what are the different, essentially getting an idea for what theorist or what theories do you use in your practice. Um, any nurse that has been doing nursing for a while that gets up to the master's or doctorate level is usually pretty good at identifying what their theoretical frameworks are. I can identify mine very clearly as Sister Callista Roy's adaptation model is my primary model. Secondarily, I use Peplow's in a relationship model. I'm a mental health nurse, so that's my primary framework. And then additionally, I would also say that I use a Jungian approach also from Carl Jung, who primarily talks about education and nursing and patient education and being very patient-centered and experientially oriented. These are all the frameworks I can use, and that's not trying to make it sound like I'm doing something special. Really, my practice has evolved, and as it's evolved, I've been able to identify theories that match my practice rather than the other way around. It's not like I've learned a theory and then said, okay, I'm going to practice my theory like this particular practice. So this what the discussion is going to be this week, talking about these different theories and how they match and how they are a part of nursing practice and a part of it is what we do and how it's reflective of what we do. And speaking of reflective, your other assignment this week is you have a reflective journal. I have revised the data in the journal. I'm going to have it due on Sunday. I like to keep things consistent in class, so discussion questions will always be due, the initial response by Wednesday, your feedback to peers by on Saturday. Anything written that you turn in, I'm going to have due on Sunday. I just think you should have to the end of the week to get things done rather than having it due the middle of the week. In this case, it was Friday. Sunday, I think, is really more fair. And so you have until Friday. I'd really rather that you do your reflective journals after you do some of your the discussions this week and participate in the discussions. The grading for week 1 will be done primarily, I would imagine it probably by about middle of the week this week. I'm recording this on Halloween evening, and happy Halloween, everybody. I think that we should have, or I should have everything done probably by Wednesday or Thursday as far as grading for that first week. I posted an announcement. Don't worry about the titles that you give your post. It doesn't matter. I don't care if it's your first or second post. I'll be able to track that when I go to grade. You can give a post whatever title you want to. Anything that you think might catch somebody's attention, that's perfectly fine to go ahead and do it that way. Likewise, don't worry about if you need to rename a post, posting another message to try to correct that. You're not able to go in and edit your post once they're posted. There's a good reason for that. But if you do forget to put something in, and if you want to add it later, perfectly fine to go in and just go ahead and just write that as an addendum in an attachment post. For example, if you forgot to post your references, for example, it's perfectly fine to go in and do that again. That doesn't count as another posting for the week when it comes time for me to count postings, but just know that it is fine for you to go ahead and do that. Also, I do follow the grading rubric pretty carefully or pretty closely for the discussions. You'll get a better feel for me after this first week when I give you feedback. I'm concerned well, I focused, I wouldn't say concerned, I'm more focused on your contribution and your depth and scope of contribution rather than just the number of times that you contribute. The number of times is important. I want to see that you're participating through the week and not just on one day of the week. A more insightful post that asks a lot of questions and brings some new information is going to score better than one that basically just reflects on what's already been said and just gives an opinion or something. But you'll get a better feel from me after this first class exactly how that grading goes. So I look forward to another great week of class. As you have questions, please feel free to post them. If you have anything that you'd like me to address in a video, please do so. This is a little bit long for a video than what I usually post. Most of my videos usually are less than 5 or 6 minutes long, and this one's coming closer to 10 minutes, but that's because there's a lot of information I need to cover right here at the beginning. but always review my video posts because I tend to summarize a lot of information and give a lot of direction for the class in there. It just seems to be the most, I think, the most personal way and the most expedient way for me to get the information out. So I look forward to another great week. If you're a Cleveland Indians fan or a Chicago Cubs fan, well, good luck to your teams. I'm out here in the West Coast, don't really have a horse in that particular race, although I do like baseball, so we'll kind of see how it goes. Everybody have a great, wonderful Halloween, and we'll look forward to seeing you in a discussion forums.